Hello, my name is Jeff Rolka, and I want to welcome you to this week's live event. Yeah, the chat's open, so please be not shy. This is your live event. So if you have questions or comments or concerns or requests or something else entirely, please feel free. The chat's open. And we will follow the course of discussion as we proceed through the next hour of time. By way of getting started, if you've chosen to subscribe, thank you. And if you haven't yet, I hope that you will consider doing so now. Nothing is coming up yet. So actually, I received a comment regarding the video that came out this week, which was around performance anxiety. And it was a very, very adept comment, basically asking about what one might call the spiritual side of performance anxiety. Hello, Altug. Hello, Tadeus. Hello, JC's Radiant Ray. Hello, Danielle. I'm doing better, thank you. And Altug is saying hello to you all. Good afternoon, everybody. And I thank you, JC's Radiant Ray. I need to remember to mention Sequencer. If you want to have more interactions with all the people, or some of the people anyways, there's like not quite 100 people I think on Sequencer, but if you want to have a little bit more interactive interplay between the people that regularly show up for chats and use the channel regularly, Sequencer is the closed group on Facebook that I put together and am moderating. And you can look us up on Sequencer and join up, and then you can ask questions and we share different things. You'll see if you decide to get involved. Hello, Wolfgang. Hello, Heidi. Welcome back. I have not seen you pop up in the chat in a while. Yeah. But getting back to the question, there was a question about what one might call the spiritual side of performance anxiety, or the sort of internal dialogues that can occur. And I am going to address that in my newsletter. I do a monthly newsletter, although I think I've missed a month or two now. But and I meant to get it out today. It's going to come out probably Monday. But I'm going to address the sort of internal dialogue and that side of performance anxiety in my newsletter this month. So if you want to get in on that, jeffrolka.com. There's a pop-up if you haven't been there before, and you can use the pop-up, or on the front page, the home page, you can sign up for the email list, and you'll get that newsletter as well as instant access to my online teaching method, which is there on jeffrolka.com. It's very similar to what you find here on YouTube. It's just that it's in organized fashion, so you can follow it step by step. I'm Jeezy. Jizzy? Hello. Yeah. Hello, Jeff. First time here. I'm watching you live. Welcome. Thank you for showing up. Michael. Jeff, so good to see you. Greetings once again from Nigeria. And greetings to you. Altug. When practicing aligning the vowels, is the order E, A, A, O, U same in both chest and head registers? Yeah, that is a sequence of vowels that is derived from narrow and the direction that the vowel typically focuses in the speaking voice. So E is a narrow vowel that wants to come towards the teeth or the front of the face. A is narrow, less narrow than E, but and a little further back. A is more open than E or A, and it's a little bit further back. And then you switch over to O, which is open and tends to want to fall back towards the rear of the oral cavity or throat. Finally to U, and U in speech is the furthest back and the narrowest of those vowels. They meet at the schwa vowel, which is neither. It's kind of open. It's a somewhat amorphic vowel, and for that reason, it tends to get avoided sometimes, which can lead to problems because obviously we don't want to avoid these things. We want to practice them. But that is how that sequence is arrived at, and it's the same throughout all the registers of the voice. What you may find is that what works in your thyroarytenoid dominant singing voice for alignment practice will not necessarily work as well in your cricothyroid dominant singing practice, your upper register or head voice. Typically, E is a great place to start in thyroarytenoid. A is a better place to start in cricothyroid because of the slight more openness to it. But therein lies the problem. If you haven't really gotten your vowels to align in your thyroarytenoid dominant singing voice, your chest voice, you may not have the ability to place the A vowel properly in the cricothyroid dominant. So, the two registers inform one another, in my experience, in practice, but we want to make sure that we have a solid A vowel before we start using that as our tonal onsets above the secondo passaggio. Gerald Ryan, hello! Hello in the Philippines, burning the midnight oil. Forgive me, Delphini Evenwi, I hope. Thank you. I really appreciate that. I'm glad that you like the videos. That's very cool. Tadeus, I've been told I'm a countertenor, contemporary, due to my timbre. What warm-ups should I? Tenor doesn't go high enough. Alto doesn't go low enough. You might try some of the extended range tenor videos. Those cover quite a wide range, mostly up to C5, I think in some cases. I might also suggest that you warm up in stages. So use the tenor full range warm-ups to do, the vast majority of your work, and then switch over to the alto when you want to do higher range things. I am going to do some more warm-ups I'm kind of waiting for my equipment to arrive. So the warm-up videos may be a couple more weeks before I actually get to start doing warm-up videos again. But I do intend to do some more kind of extended range warm-ups in the very, very near future. But right now there's 2 or 3 videos that cover extended range. Maddie, hello Maddie. Thomas F, hello Jeff, amazing your work, keep it up. I absolutely am going to. Thank you very much for your kind words, I appreciate it. Tadeus, how can I sing and dance at the same time without sounding shaky? Oof. A lot of practice, reasonable amount of planning as well. For the things that are perhaps most, I would highly recommend that at least in the beginning, you try to choreograph your moves so that the most difficult aspects of your singing are not timed with giant jumps or spins or something such as that. Additionally, you may consider timing your moves as well so that your body motions either align with downbeats in your vocal melody or rests in the middle of your vocal melody. Basically, it's going to be a combination of practice and coordination with your choreography. I would additionally add, however, that as your overall stability in how you are maintaining your engagement with your voice solidifies, you should be able to move reasonably well and still phonate effectively. And if you're finding that if it's like really all falling apart for you, I would address your expansion and engagement and how you're maintaining the engagement of your voice, specifically the core muscles, because that is the process of appoggio ultimately results in a dynamic and very supportive system, but it's also very flexible. So you should be able to move around, do dances, whatever. But yeah, those 3 things: assess the engagement and the consistency or stability of your engagement and suspension of the voice, address the choreography and how it aligns with your vocal melodies, and consider not putting your hardest dance moves with your hardest vocal sections. Altug, I practice the, presumably that's A vowel, with may and ni, nay. Can you recommend other consonant vowel combinations for the A vowel. May is probably my favorite. There's another exercise you can do. Ri, re, ra, ro, ru. That would be the 5 different vowels. You can also do, what is it now? Ri, me, ne, le, re. I forget the exact sequence now. I'd have to go through my notes and find the sequence, but basically, le, me, ne, ne. Those are good ones. Basically, anything that's partially phonating. So B's and T's and D's aren't going to work quite as well. L, M, F, or you know what's a really good one? Now then, you got me thinking about this. There's a really, really good exercise. I don't think I've done this actually in the videos, but if you say v, like a V, but like mash it together with an F. So you've got a v, right? V, 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 V. It's a very airy sounding V sound, and that can be a really, really fun exercise to do with that vowel. And as I think about it, I haven't done that with other vowels, so I'd have to try it out and see how it works. But I have used it with that, and that works quite nicely. Heidi Banker, about internal dialogue, it's also about how you process failure. Agreed. Yeah. I might even take it a step further and question what failure is. Like, how do you define failure in your performances? How do you define failure in your practice? Thomas F., what exercises would you suggest for days, weeks where you do not have much time? Off the top of my head, the daily warm-up, which is an older video that's here on the channel, was supposed to do that. It was supposed to be 10 minutes or less, and it was supposed to hit as many, it was supposed to tick as many boxes as it possibly could. It ended up going a little long, but probably if you cut the intro off of it, if you like got right in when the singing begins, I bet you'd get it down to 14 or 15 minutes. It depends on how much time you're talking about. If we're talking 5 minutes, then I would probably do, in 5 minutes, we're kind of talking about either we're just getting started here with our voices or we're talking about maintenance mode. So I'm looking at exercises that are long duration with virtually no rests. Really long phrases that hit on all the vowels. If your airflow isn't up to that kind of an exercise, then maybe just a couple minutes of bubbling, or even tonal balancing things where you're doing like we, you, to make sure that you're staying balanced between airflow and vocal fold engagement. Pardon me. Ross, hiyo to you. Wolfgang, how do I know what voice type I am? Tenor, baritone, alto. Okay, so if you're really new to singing or new to vocal study, even like if you've been singing forever, but you're just starting to practice with like the exercises and the kinds of things that you find on my channel, give yourself a couple weeks at least, or a month or two, because finding your fash, as you'll hear me refer to it, F-A-C-H, it's not necessarily something that we arrive at and stay to. Different teachers will label your voice differently depending on how they have studied and how their teachers taught them. And different schools of voice categorize the voices differently. Mostly, it's gonna mostly boil down to where the secondo passaggio is and the kind of overall characteristics of your voice, not necessarily the overall range, like high or low, but what does your voice sound like and how does it perform? That has a lot more to do with how your fosh is delineated than ultimate range. Now, I recommend, and I apologize for all the throat clearing, by the way, too. I'm still getting over this thing. Between the cold that I got and the move, I think my immune system just got like a 1-2 punch, and it's been a long time. But so the reason why I suggest that you be patient with determining your fosh is because if you have not been part of a vocal practice such as you find on my channel, finding the specifics around your secondo passaggio can be very difficult. And as your voice in the zona di passaggio, which is the area right around the secondo passaggio, right below it, as your voice and the phonation becomes more and more refined, the secondo passaggio will become more defined, and that will tell you an awful lot about what your fosh is. And that's why I and many other vocal teachers will say, like, let's just wait on the fosh for the moment here. Like, don't rush into this. And furthermore, people too frequently, I don't like to generalize, but very frequently people get very hung up on fosh. And as a teacher, I am very reluctant to dive right in and say, oh, well, I can easily tell that you're a baritone or a tenor or yada, yada, yada. Because people can come to really identify with the fosh. And I have found over the years that when we work together, whatever you thought your fosh was, as it becomes more defined and you see that the way that it's defined does not limit you, it becomes less of a big deal to say like, oh, I'm a baritone or I'm a tenor or something like that. So, where's the secondo passaggio? What are the overall characteristics of your voice? That will determine it. Generally speaking, if you're a male vocalist, you're a tenor or a baritone. If you're female, then you're either alto, mezzo, soprano. Each of the individual foshes, as I've mentioned there, have different categorizations within them. There is a lot of overlap. So tenors will very frequently sing in similar ranges to altos. It's just that the secondo passaggio is in a different place. Tadeus, do you have any instant effective tension jaw busting exercises and relaxing the muscles around the larynx? Well, the main thing with that, I mean, it won't necessarily remove the tension, and I don't know if that's necessarily realistic. But the one thing is to hold the jaw open, so find a neutral but open position, and then hold your jaw still. What can happen here is that because you're holding it, the jaw muscles will release as you sing through your vocalizations. And so in a sense, that instantly releases the jaw musculature. That, however, won't work once you let the jaw go. So once you let it go, you're probably going to come back to it. So it's a process of learning a new habit around muscle engagement at the TMJ joint, the jaw musculature. Larynx, kind of similar, but that's the tongue thing. So in the video, there's a video out there where I have you stick out your tongue and grab it. By taking the musculature, the tongue root musculature out of the equation, that will frequently mean that the musculature around the larynx will release a lot more. Once again, you have to develop the habit with practice. So when you release the tongue, you're probably going to fall back into your old patterns. But by practicing that way, you can learn to release the musculature. Hello, Jeff. This is David Simmons. I'm a bass baritone that really wants a grasp of the passaggio. How do I place them? Singing into the zona di passaggio is, I think of it more as a process than a quick fix. In order to facilitate airflow in the zona di passaggio, the vowels widen ever so slightly. In particular, the E's and the U's. Ah and O, however, occasionally will actually feel narrower to a vocalist, though I think the actual aperture of the vowels, the way that the vowels are formed, is rather similar throughout the ranges. If you really want see, but you're not actually asking about vowels. That was something that I assumed. So what are we talking about here? Are we talking about vowels or notes? Notes don't really exist without some type of vowel on them. So we have to have some type of vowel as a medium. The beginning for it, if you're not successful, you're new to the practice, then oo would be the one I would choose, because that's going to keep you on the vocal fold most easily. You. You'll notice there's a coloration difference between the first note I'm singing and the remainder of the arpeggio. That hollowness is desirable in the beginning of our practice when learning how to use our upper registers through the zona di passaggio. So that would be how I would start. But perhaps I'm missing the point. Feel free to chime in and give me more information, and perhaps I can be more specific. I'm Jizzy. Yes, really love your vids. You make me sing a song a little bit easier than before. Still practice from your video. Wonderful. Thank you for watching, and good luck. JC's Radiant Ray at Heidi. Johnny Lipstick, hey! Delphine, +1 for Dedeus' question. Thomas F., how often should I practice to have a healthy development of my voice? Every day, and whatever you can manage. The most important thing is that it be sustainable and as a daily a practice as you can possibly manage. So if you've only got 5 minutes, but you can do it every day, that's a good place to start. Do that. Keep it sustainable. That's the main thing. But as daily as you can possibly make it. Ross, hi-oh. I think you said hi-oh before, unless I'm rereading things. Johnny Lipstick has a question for today. Excellent. Altug, does singing staccato feel like the sensation of laughing? Yes, to a certain degree, except that the sensation should be higher up and more at the solar plexus, so right below the sternum. Let me see if you can see where my hand is. Yeah. So like shoulders. This is my hip bone. If I sing staccato, he. The fluctuations are right here in the musculature. This is all remaining persistently engaged, if that makes sense. Hello, Mrs. Webster. Welcome back. TJ Relly, pardon me. Hey, Jeff. I can ooh and ah in falsetto, but I can't seem to form words without cracking and making no sound. Suggestions? Well, it depends on what you mean by falsetto. Because if you're here, where it's really airy, then you're partially adducting the vocal fold, and I'm not surprised you're cracking, because the vocal folds are only barely just meeting anyways. If by falsetto you're meaning cricothyroid dominant singing or head voice, then what's happening is the cracking is occurring because your old habits of how you formed words, basically your technique isn't yet developed enough to keep the vocal fold adducted as you change. So address your airflow and address how it changes when you start to use consonants and words. I would suggest you take a look at your practice thus far. If you've been primarily doing descending exercises and been successful with them, you really have to take it as a step-by-step process. Even you can do it all very quickly if you just work very diligently with it every day. But you have to be able to go from ascending and descending patterns with those vowels, and then working towards getting all the vowels in there before you're really going to start working on words. But you could also practice the words without the consonants in the range, working to get alignment with the vowels and then reinserting the consonants later. Johnny Lipstick, what is your ritual of choice before a gig? Food, exercises, wherever you think of or do. Tenor right here. I eat about 2 hours. Okay, so let's just say, let's say that it's an evening gig. So I'm doing the gig at between 7 and 9 p.m. Or something like that. Whatever. It doesn't really matter if it's in the evening, whenever it is. Exercise before noon during the day. Probably some warm-up and practice and going over notes and things like that for the gig that night. Any kind of what I think of as admin things, like printing charts, making sure I usually have a cello player when I play, so making sure I've got their charts just in case they forget them. Getting my clothes, all that's kind of stuff that you do it because it's part of putting on a show, right? You get your clothes arranged, you make sure everything is right, you make sure your strings on your guitar, if you're playing guitar, are fresh enough, or hopefully you changed them a day or two ago, if not. All that kind of stuff. Reasonable lunch, nothing too significant. Usually for me it's going to be a salad of some kind without dairy products, with some carbohydrates. I might have butter on the carbohydrates. Like if I'm going to have a potato, it'll be with butter and a little bit of stuff like that. Real kind of, neutral food, like salads and things with lots of vegetables, maybe some type of protein, but maybe not. Just depends on how I'm feeling that day. Basically, I'm going to have a very light meal about 2 or so hours before the show. As I'm getting ready to do the show, I get dressed well in advance because I am weird like that, and I have this thing about wanting to feel into my clothing that makes no objective sense. That's an entirely subjective thing. There's only one shirt that I wear for performances. So I want to get that shirt feeling right. And then usually, I know that it's important to be with people and greet your audience and do all that. But I do all that. I don't talk a whole lot, particularly if it's a loud environment. And then about an hour before I'm going to go on, or more if possible, then I go backstage and I usually do my vocalizations, but then I like to sing songs, usually Beatles tunes. And I'll sing them, and if there's other people to sing with, I might sing harmonies, and we might sing harmonies together if there's a band, and do all that kind of stuff. Usually, no matter who's playing, we're all playing guitars and singing, and then we go on stage. I'm Jizzy. I don't know my voice type. I think I'm a baritone, but I can do tenor exercises. Yeah, there's a lot of overlap in the vocal fascias, a lot of overlap in there. That's not surprising at all. I talked about that quite a lot at the beginning of our time here today. So what I'd like to suggest is once we're done, YouTube will publish this to the channel. And if you want more information about that, if you wouldn't mind, so that I can take more of the questions, go back and have a listen. It was probably around 10 or 15 minutes in that I started talking about Fosh in depth. Altug, what does lowering the jaw mean? Think the sort of teaching around jaw and its level of openness has changed a lot over the years. And what I would focus more on jaw flexibility more than how wide or closed it ultimately is. Basically, and I don't know that I've actually covered this very much in the channel as well, but if you're singing, a nice exercise to ascertain jaw flexibility is just to start with a narrow aperture and open and close it. What we don't want is for it to pop open when we change vowels. That's not a flexible jaw. That's a different kind of tension and engagement. But yeah, lowering the jaw typically means opening it downwards. And that used to be the age-old advice, right? Open your mouth, like let it out, open your mouth wide. But that's changing a lot, particularly for the oo and o vowels, where a kind of reverse megaphone shape can actually generate more resonance for those vowels. In that instance, though, we do need to make sure that the lips have a bit of a flare. Otherwise, the lips tend to hold back a lot of the sound. I'm remembering to do my station identification. My name is Jeff. If you've chosen to subscribe, thank you. If you haven't yet, I hope you'll do so now. Sequencer is our Facebook group. So if you want to have more interactions and things like that with the people that are here regularly and use the channel, head on over there and put in a request and I'll sign you up. Ross, can you sing, I think you mean us a song. And I could, but normally I allocate this time more for answering questions. But maybe I'll do that in the future. I'm not really ready to do it today. I haven't given it much thought as to even which song I would sing. And I'm very, very conscientious about copyright infringement on my channel, and these live events are subject to that as well. And this may seem funny, but the music that I create and the songs that I write are under an exclusive license for distribution from a company called The Orchard. And so if I sing one of my previously released songs for you right now, it's quite likely that I'll get a copyright strike against myself. Now, it'll get resolved, but I don't like to I don't incur those things lightly. So let me think about that. And if you ask me to sing a song in the following weeks, I'll sing you a few bars of a song that I will be certain is cleared for it basically be a part of the public domain, or it's something that I've written that is not yet released, and so it's not a problem. But that's a different kind of problem. I have to think about this carefully. I'm sorry. Thank you. Heidi at JC's Radiant Ray. Today is how can I do vocal grunts? At the risk of seeming somewhat base, just grunt. If that's what you mean. It's kind of a vocal fry. I suppose what you really want to make sure is that you're supporting it like you would support anything else, so that you aren't overly taxing the vocal folds. You want to make sure that you're providing enough airflow that it's not too aggressive on the vocal fold. Delphine, I'm a female tenor. I have trouble with too much breathiness in my head voice. What can you recommend to fix this? Also, lip trills make me dizzy and lightheaded, which would also suggest too much air. Right, well, I mean, it would seem fairly clear that you're only partially adducting the vocal fold in all instances. If your lip trills are getting dizzy and lightheaded, you're probably, yeah, you're keeping the vocal fold separated, so there's a lot of air leakage. Try the chord closure video, which I released probably 6 or 8 weeks ago now. And that has a bunch of exercises that you can run through to work on chord closure. There are two methods to approach it. One is, I like to approach it from trying to balance things out rather than an overtly hyperglottic position. So you'll find people that'll say, like, make a creaky door noise, like a but that creates another problem in that you're using so much vocal fold tension to create that noise. That's all going to have to get undone eventually. So have a look at the chord closure video. It mostly focuses on short vowel syllables, and that is where the practice of attaining greater adduction or chord closure begins. JC's Radiant Ray at Mrs. Webster. Jill Bryan, where am I now? I am in Calamita. I'm in Alameda, California, Northern California. Naveed is retracted. JC's Radiant Ray at Heidi Banker. Johnny Lipstick, also, how to deal with massive changes of weather. I have major sinus allergies, and last year I went to London for an audition and my voice disappeared. That gets into, particularly around auditions, we get into whatever works. The changes of weather are hard on me as well. Usually it's harder for me going into the colder seasons than the warmer. If you have allergies, I do not have allergies, and so I'm very fortunate that I don't have to worry about that. But particularly around an audition, I would consult your doctor on this, but whatever works. If it's Claritin or things like that, Mucinex or guaifenesin, which is a mucal inhibitor, could also be helpful in terms of keeping your voice intact long enough to do the audition, and then, just letting nature take its course after that. But you need to speak with your doctor about that. I cannot advise you on medical things. But that's where I would begin, particularly around auditions and important things like that. In general, though, you'll see me wearing scarf. I'm not wearing a scarf today because I have a lavalier mic on, so that you can hear me. Hopefully, you can hear me better. It seems like it's pointed okay. I'm not wearing a scarf right now because I have a lav mic, but I'm going to put it on as soon as we're done. I've got a couple layers of wool on to make sure that my torso is nice and warm. Basically just keeping warm, lots of fluids, stuff like that. Fufa! Thank you for all your baritone videos. You're welcome. Thank you for chiming in. Gerardo made it. Wonderful. Welcome. Danielle, Jeff, is it possible that somebody who started piano at age 20 become good as a person who started from 5 and both be at the same level when they're 40? Boy, the differences between, in a hypothetical situation like that, who knows? The variety of things that could occur are so varied, and I, for one, am not ever gonna underestimate what someone can achieve. In my teaching over the year, and I learned this lesson, I still learn this lesson. I learned this lesson a couple weeks ago. Never underestimate what you or your people can do given sufficient motivation. So if you're 20 and you're looking to get started, who am I to say? Like, I have no idea who you are, what your ambitions are, what your and I'm speaking as if this is you that's asking the question, and that could be wrong, but whether it's you or somebody else, like, I can't know your motivations unless you tell me, and I don't know what levels you're willing to go to achieve what you want to achieve. What I would say is, I'm thinking about, I believe his name is David Rhodes. It's either David or Daniel Rhodes, Rhodes, and his story is somewhat tragic, but it has a good ending. He did a book a year or two ago, which is, if you have had a violent past in your upbringing, it may be unsuitable for you, but it's a very inspiring story where he basically decided in his mid-30s to be a concert pianist, and he is. Thing is, the difference here is that he had training when he was younger, but he abandoned it for a long time. Not exactly what you're talking about, but basically, not for me to say. It's up for you to decide what you want to do, and if you're willing to pursue it. Thank you, Johnny. I'm feeling much better. I'm still a little goopy, as you can hear. I'm Jizzy. I love classic rock, but my problem is I can't sing full song. I get strained and don't have enough breath. There's a lot that could be causing that. Address your airflow, address your vocal balance so you're not straining as much. Straining is not the answer. Delphine at Wolfgang, Heidi at JC's Radiant Ray. Today is, how can I stop tension while doing whistle tones? Presumably, if you're having tension in the whistle tones, I have to assume to a certain degree that there's tension elsewhere in the system. That being said, it's not necessarily the case. have to say, I'm sorry, like whistle tone theory, like teaching whistle tones is incredibly difficult. And I don't even really have any clients that do that regularly. So it's hard for me to say. My assumption is that you have tension elsewhere in the system. But because of the nature of the transition from normal phonation to a whistle tone, that is not, I cannot make that assumption and feel entirely good about it. But I would begin by addressing airflow and engagement throughout the other registers of your voice and trying to notice if it's present there, and then begin to work my way up into the whistle register. Karina, hello. Delphine, not done this live before. Nothing happening on video screen. Can the rest of you see me? I assume you can see me. You should be able to see me. I thought you could see me. Let's see. Where are we here? So, can you see me? Yeah, the video is showing. Not sure what's going on. Danielle, how to strengthen the voice to avoid the cords getting tired too soon. Okay, so yes, there's a certain amount of parity of strength between cricothyroid and thyroarytenoid muscles, but think about this more as balance and adduction. When you have a balance between vocal fold engagement and airflow, there's more release around the vocal folds in order to resonate more fully. More full resonance equals strength. More muscle tension here is going to reduce resonance and reduce strength. So think about balance, airflow, and resonance, and the resultant sound will be a stronger sound. You will almost certainly find, having done that your overall fatigue level will diminish greatly. You'll be able to sing for longer periods of time to greater effect, and it's just not gonna. It won't be an issue. You'll have the strength that you're looking for. Mrs. Webster, thank you, Jeff, for posting about stage fright. It's been a long time since I've needed that addressed, but evidently it's a stress-filled day today. Well, I'm sorry to hear that, but I'm glad the video was there. More to come on that, as I mentioned, in this month's newsletter. Heidi Banker saying hello to Karina. Delphine, +1 for Daniel Abid's question. Maddie Hendricks, love the performance anxiety video. Wonderful. I am singing next week in recital class, where I get the most nervous, understandably. I think what makes me nervous is waiting backstage, the moments right before I go on. Absolutely. Yeah, absolutely. Karina is saying hello to Heidi. Karina, nice to see you here. Delphine, a link to the stage fright video, please. I think I'm not. I will. I should have put that in the most recent. I need to do like a most recent video, or if you go to the channel page, there should be. It should be right there at the top of the list because I just released it on Thursday. Today, how can I mix belt A5? I wouldn't. Well, depending on your secundo passaggio, I wouldn't necessarily recommend A5. Depends on your fash. If you're a male vocalist, I would not recommend that. That's going to be well into the falsetto range. But again, falsetto in that range does not sound like. This is the battle with voice teaching. You say falsetto and there's a certain connotation around the sound of it. Falsetto in the appropriate range doesn't sound like we have come to the association we make with that word. It sounds quite full and solid. Even then, I'd have to assess more. That's well above C5. And for a male, if you are a male vocalist, then I'd have to listen. Karina and all fellow singers, I am Jizzy +2 for Danielle Abid's question. Navid's retracted their question. JC's Radiant Ray, yes, thank you, Jeff, for the stage fright video. I practiced, but I know I will not be good, let's say next Sunday, as good next Sunday as I will be a few months from now. This thought makes me nervous. Yes, I can dig that. yet and that's why in the video I talk about a sort of process of increasing, like a process of increasing commitment, where we take these sort of small steps forward towards kind of upping the environment that we're in, upping the anxiety level of the environment. So maybe, it's a trusted friend, or even it's just a recording. We can get nervous around recordings. I get nervous making the videos for the channel. And then we do it again, and we note the changes that we've made. What have I done differently? What have I done the same? How did it feel? What's the overall experience? Noticing these things, you'll see in working on one's voice or working on performance anxiety, I focus a lot on us noticing and becoming aware of the experiences such that we can take a more conscious control of those things and try to cultivate a scenario where we have the best possible outcome. So like for Maddie, she's waiting backstage. Well, what are we doing backstage? Where am I standing? Am I standing? Am I pacing? How does that make me feel? Am I doing any kind of subtle warm-ups? Am I using a mirror? Like, what's the environment? Like, what's the total experience of it? And what have I done in the past? And what has the effect been? What can I change? And then notice the effects. And we have to go back and do this again and again and again, which is why I try to take a very gradual approach. Because if we try to go from singing alone in our bathroom to standing at the most populated open mic, we can get really unfortunate results, which I don't want for any of us. Brittany T, hey, hello, haven't seen you in a while, welcome. What would you suggest to singers dealing with depression to keep to a regular practice schedule in order to continue to grow rather than go through cycles? Oh, well, I'm sorry if you're dealing with that. That almost, in many respects, that sounds like a question that you might also ask if you are under medical care, if you have a doctor or a psychiatrist or psychologist that you can ask. You might ask them as well. My beliefs around this are that we have to sort of set, it revolves around a lot of setting aside judgment. I'm not going to judge this, I'm just going to do this. So whatever comes out, however it feels, I'm going to do this, and I'm going to do it for 2 minutes. Whatever I could possibly, could I do it for a minute? Could I do it for 2? If you have a clinical depression, I don't know what a realistic expectation is for you. You and your doctor would need to make that assertion. But I would start with what I can do today. And I would think only about that moment as much as I possibly could. Just focus on that moment. I don't have anything that I have to do for the next hour. I am going to do a minute of wheeze. Wee, 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 wee. And then I'll be done. That's what I would recommend you do. Set aside judgment. Just, try to do it. But again, clinical depression is a very serious thing that I can't entirely speak to, and I don't know about motivation around it. And so that might even be asking too much. Maybe the only thing you can really do is to ask yourself to hum. And that at least will keep your vocal folds moving a little bit. And while it's not necessarily like a complete practice, it'll do you a little bit so that when you can do a complete practice, you're not starting from, oh, I haven't used my voice in 5 days. Mrs. Webster at Delphine, how to put rasp in head voice. Female tenor, you're gonna need to I have to kind of move quickly here because I really do have to end on time today. I am almost ready to do that video about raspiness in the voice. It involves partial adduction of the vocal fold and allowing the ligament on the outer surface area of the vocal folds to take on some of the vibrational capabilities. It effectively is a vocal fry. Delphine at Mrs. Webster. Mrs. Webster at Brittany T. Carolina, make me music. Hello in Sweden. Welcome. Just want to say that I really appreciate your help. I do them every day, and they're really helping me develop super fast. Awesome. Thank you very, very much. Brittany at Mrs. Webster, Maddie Hendricks, I have had a great breakthrough with tongue tension. My teacher had me do the exercise you talk about, sticking the tongue out and holding it. Could barely do it at first. It's getting better. Wonderful, wonderful. Keep at it. It's brilliant. Mrs. Webster at Brittany, Carolina, make me music. Question, I lost my voice a few days ago and I have an 8-hour studio session in a few days. Is there any great vocal warm-ups, exercises I can do to help me get back on track? Start with a gentle warm-up. I mean, if you lost your voice, you need some TLC on the vocal folds. Gentle, 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 gentle. David Simmons, no, that was great. Thank you. You're very welcome. Greg, hey, Jeff, do you have advice for keeping consistent resonance through the zona de passaggio? I now have no trouble with the transition over the passaggio, but sometimes I lose some of the resonance. Short answer, check out the resonance video that's on the channel. If you look for resonance, you'll find it. It's a process that I use. It's a comparative process where we take whatever video you can phonate successfully through the zona de passaggio or into the zona de passaggio and maintain the resonance, and then A/B it against all your other vowels. That's the short answer. Altug, in notes in the zona de passaggio, before I was not noticing any vibrato, but now I feel some vibrato. Of course it's okay. What is happening? What is giving the vibrato? Ideally, vibrato is vibrato is the result of a well-functioning, well-aligned mechanism, vocal fold system. So the subglottic pressure is sufficient so that the vocal fold is maintaining good release, and there's a little bit of an oscillation. It's like both of them are kind of working together, pressing back and forth on one another. And you get that oscillation, you get the vibrato. In English, your airflow is good, your vocal release is staying good because of the airflow, everything working together. And so they kind of oscillate a little bit. They're kind of, testing the waters, and you get the vibrato. Totally fine, to be encouraged. Mrs. Webster, love today's discussion. Thank you, Jeff. I don't need to ask a question today since you've covered it nicely. Wonderful. I'm glad. Excellent. Yeah, these have been awesome. I've loved these since we started them, the live events. But the questions they're incredibly thought-provoking for me, and I so much enjoy having this time with all of you. Bhavya, I am finding it difficult to find that placement in my voice. If you're finding it difficult, go back to the short exercises. We, you, may, ha, ha, that sort of thing. Those help you to find the placement where you've got a good airflow and good vocal fold engagement. That's a place to begin from. Bhavya, singing for more than 30 to 45 minutes without getting hoarse. You're using way too much vocal fold tension. Assess your airflow, just like the exercise I just recommended to you a moment ago. Assess your airflow, assess the balance between vocal fold engagement and airflow, and that will result in you being able to sing longer. If you are getting hoarse regularly, you really need to reassess that or stop. It's hard to say without hearing you what kind of long-term fatigue and damage you could be doing, but I really must recommend that you assess airflow and balance so that you can not get hoarse like that. Can a glottal onset help me have a chestier, stronger mix? No. Glottal attacks will almost certainly weaken your overall phonation in the zona de passaggio and cricothyroid dominant singing voice. Even if they do simulate more resonance, it's just not worth the long-term fatigue and damage that you're going to do to your vocal fold. That is perhaps the fastest way to injure yourself. TJ Riley, thank you so much. You're very welcome. Greg at Bhavya. Farouk, hello, sir. I adore your work. Thank you for all your efforts. You're very welcome. Baritone and sing fairly high for my recent vocal endurance. Well done. Sometimes higher. What do you recommend for keeping up? Keep going. Maybe check into the extended range warm-ups that I've done and maybe see how that feels. It sounds like you're doing great. It always pays, I think, to continue to evaluate. I talk about airflow so much, and I don't want to sound like a broken record, but it keeps the vocal fold released, and it helps us stay healthy, and it helps us do all the things that we want to do. And so frequently, I find that in a singer's, when they report a variety of maladies and problems, we come back and evaluate their engagement and airflow, and it's like, it just fixes itself. No, it didn't just fix itself. You assessed the problem, you addressed it, and now you have increased abilities. So check into the endurance things and see how it goes. If you find that they're challenging, address the airflow such that you can stay released and continue to phonate. Keep going, man. It sounds awesome. Danielle, how many shows do you do in a year? That depends on your definition of show, and it depends on yeah, basically your definition of show. I consider this to be kind of a show. So in that sense, quite a few. I have not been performing as much recently, but I used to do upwards of 100 shows per year. And when I was hired immediately out of university, I was an entertainer at an amusement park where I did a little over 700 shows in the span of 6 months' time, 5 or 6 months' time. It was like from May through September or something like that. But recently, unless you want to include things like this, I have not been performing quite as regularly. But I suppose if you counted private performances, that might be different. So I don't know what you count as a performance, because I might consider private events to be performances. I guess those are, but it's not a show per se. Yeah, I know it's kind of a vague answer. If you're talking about club gigs, not a lot, not very many at all, and I haven't actually done a bona fide club gig probably in about a year right now. I've been focusing on different kinds of performances. Bhavya at Greg, Mrs. Webster, glad you are keeping hydrated. Get well soon, Jeff. Thank you. JC's Rainy Ray. Yes, Jeff, almost 3 decades ago, I remember Chaka Khan sang with a powerful, loud sound, but she would barely open her mouth. There you go. Karina Chen, love your hi, he, and you exercises. It helps with breath support. Can you give us more exercises to help with breath support? Yes, I know I owe you a new Apogeo video. And actually, that might be a really good video to do while I'm waiting for equipment to arrive. Monsieur Maubet, hello Jeff, and good evening to you. Quick question. I heard just a bit ago about how you wear a scarf. I never knew it was important to keep the voice warm on the outside. I need to keep it warmed up. I think it's just more about like overall comfort. I don't know if the outer garments actually, you really, I haven't really looked into that, but I know it keeps me overall more comfortable in general. Mrs. Webster, sinus problems, look up lymphatic massage on YouTube. A very good tip. Daniel Lee, thank you for helping us. You're very welcome. Gerald Ryan, you are amazing. 2:40 a.m. Incroyable. Skite about glottal compression. If you mean a video, I can look into that, sure. Paul, excellent. I'm glad I'm visible. JC's Rainy Ray seconds that. 5280 Coaching agrees as well. Very good. Skite Hussein, yep. Skite Hussein, how to develop a whistle register. I think that I hit it sometimes very high notes that I can sing quite easily, but it happens just sometimes. I wish to be able to do it every time I want to. I will look into this more fully. I have only scratched the surface on this, but I will delve into it more fully. I have been trying to keep up with regular releases and also do the distortion video. But I will begin looking into this and see if I can offer more insight into this, because I know that the teaching on it is somewhat limited. Paul, as a bass working with increasing my range, the higher register work against my lower range, like if I want to develop a good deep C, should I focus on one direction? You will find that phonation in the extremes initially will be somewhat mutually exclusive. You'll be phonating way up high and developing that, and then you might not phonate so well down here, and vice versa. As you get more adept at phonating the extremes, the process then becomes to put in wider range exercises that unify the registers. So stick to like shorter, like 5-note scale patterns to start, and then start doing octaves and things like that. Scanning ahead, thank you everybody so much. I really have to wrap it up today. I really appreciate it. Wade Horton, how long does it sing up last? Varies widely from person to person. Legally Blind, what is the best way to connect with the audience when you're blind? Ooh, I have to think about that, but I will think about that and answer. Recommend your channel to everyone I know who sings. Ever considered making videos with complex mode-based scales? Check the specialized scale playlist. There are some in there. Melismatic phrasing. Very cool. I will think about that too. Thank you, everybody, really, really very much. Gerald Ryan is burning the last 3% of his energy on his tablet. Thank you so much. Have a great, great week. I hope to see you in the comments section of the channel or here next week. Really love the questions. Really love all the interactions. You guys are really, really awesome. I love the way that you interact amongst each other in the chat. It's all so wonderful and good-natured. Just thank you all so much. Take really good care of your voices. Enjoy singing. I'll see you next week. Bye.